Let's find out what he's up to now. Richard?
Hi, welcome back, Leanne, to the Bongani Regional Hospital, where we've been all morning speaking to patients, the MECs, and having a look at the situation at hospitals and clinics throughout the province and what is being done, what challenges there are. And joining me now is the head of department, Dr. David Motau. Doctor, we've heard a number of people talking about one of the issues being a shortage of doctors. Now, is it that we don't train enough doctors? Is it the demand is too great for doctors? What is it that is keeping us having to always say we have a shortage of doctors?
Thank you very much for the opportunity. Let me also take this opportunity to greet the viewers at home. There is a problem with doctors. Doctors in the main are the drivers of our healthcare system. Doctors and nurses are the drivers of the healthcare system. Now, the problem here is that way back when we did not have diseases like your HIV and all that, we did not plan, we did not think that one day we're going to need more and more doctors to look after our patients. The social determinants of diseases are the ones that are actually forcing us now to have more and more doctors. Now, the problem here is that, do we train enough? We do not train enough. The output from our universities is not enough to can take care of the demands out there. The other thing is that we're also competing with the countries outside South Africa, where you would find that doctors and nurses are being recruited to actually go outside and train. But we're not sitting and doing nothing about it. We're busy engaging our universities to produce more and more doctors, but you would understand that it's issues around finances, infrastructure and all that. Who's going to be able to teach all those doctors that we bring into the system? But there is a gradual increment in making sure that we cover the demands that are out there. But the other thing that we've also done as South Africa, as the National Department of Health, and by extension the provincial departments, we've also sent students to Cuba to go and study in Cuba. And the hope is that we would get them back into the country and we'll be able to combat all the challenges that we're having. Issues of nurses. Nurses, we are now beginning to open up all the colleges in making sure that we train more and more nurses to be able to respond adequately to the demands of the challenges of social determinants of diseases, as it were. We have issues around your TB, your HIV, and many other diseases that are actually causing these challenges to us. So yes, there is a shortage of doctors.
And there's always been a perception that doctors and nurses don't want to go and work in rural areas. Is this true? And how do we deal with it?
Look, that perception is true. But government has actually made a point that they actually put systems into place. One being the PDMS, where they actually reward you in terms of your performance, the number of years that you've been in the system. But yes, we also have systems like your rural allowance that could actually assist in making sure that the remuneration is better than those that are in your urban areas. But naturally, people tend to gravitate towards your urban areas, where you'd find that the rural areas where actually the action is, where actually people are you find the poorest of the poor that are residing in those areas where you have scourge of TB, HIV and AIDS, that they don't have doctors. But we are actually addressing that in making sure that the students, the doctors that will be coming from Cuba will then be sent to these areas. They're going to be prioritized in making sure that there's coverage in those areas. And remember, healthcare is now moving towards the primary healthcare, where we believe that our healthcare system, as it is, it's a bit problematic because it's hospice-centric, and that is an expensive healthcare system. Now, if you make sure that you strengthen your primary healthcare with initiatives of the NHI with primary healthcare engineering, we'll definitely make sure that we strengthen that. We have more and more patients that being looked after at clinics, at CHCs, and perhaps to a level of a district hospital. Those that will be coming to your regional hospitals like Bongani and the tertiary and the central are only those specialized cases that can be dealt with here.
So, in essence, we really need to strengthen our clinics. That needs to be a real focus point.
We really need to do that, and this is what the NHI is coming with. And you'd realize that there are so many initiatives that have been put in place. One such is your ideal clinic, where we are saying now for a clinic to be called an ideal clinic, it has to have, one, enough staff, it has to have medication, it must open on time, and it must not turn patients away. It must have all the resources that patients would need. It must also have security, which is a problem in all our facilities, where you find that medication is stolen and we're unable to account for that. So that is those are some of the things that are contained in this ideal clinic concept that we're going to put in place. In the province, we had in Thabo Mfutsanyane, we had a pilot district where we had clinics there that that we were piloting as ideal clinics. Now we've also said, I said we need to then extend this, roll out clinics in all the districts, in making sure that they conform to that ideal concept. And in that way, we should be able to make sure that we get more nurses, we get doctors, contract doctors that will assist in that area, and we'll see lesser and lesser patients coming to this level of care.
And perhaps going to our schools to say to the kids there that maths and science vitally important, you should all be doctors.
Yes, it is important. I think in conjunction, look, as health, we belong to the social cluster with education, sports, social development. Now, in there, we discuss all the common things that we need to be dealing with in making sure that we get these students at the level where they need to be actually doctors. But we are not saying doctors, to be a doctor is the most important and the only important career in your lives. You can be any other. Nurses are also important. Other auxiliary services are also important. Remember, health is comprehensive in that we treat, when I treat you, I must be holistic. The entire team must be part of that. So yes, maths and science is important, and we want more and more of those students to do maths.
Thank you very much. Thank you. Thank you very much, Dr. David Motau. And we now go back to Ali and Ayanda in the studio with our headline news.
Pleasure. Thank you.